Hi, my name is Lauren Hayes. I will be presenting my integrative review on the effectiveness of diabetes education on adult patients diagnosed with type 2 diabetes mellitus. For my introduction, I would like to demonstrate why diabetes is a topic of significance. According to the Center for Disease Control and Prevention, 29.1 million people in the United States are affected by type 2 diabetes. It is also the 7th leading cause of death in the U.S. Healthy People 2020 writes that diabetes complications tend to be more common and more severe among people whose diabetes is poorly controlled, which makes diabetes type 2 an immense and complex public health challenge. This is why it is important for primary care providers such as family nurse practitioners who treat patients with chronic diseases in a clinical setting to know what the best practice is for encouraging health maintenance and management in patients with chronic disease. Therefore, the purpose of this integrative review presentation is to determine the effectiveness of diabetes education on glycemic control in adults diagnosed with diabetes mellitus, also known as type 2 diabetes. There is a theoretical framework that I have based my research on. It is the Middle Range Theory of Self-Care of Chronic Illness by Jaarsma, Riegel, and Stromberg. As they defined self-care, it is a process of maintaining health through health-promoting practices and managing illness. They defined three concepts within their theory: self-care maintenance, self-care monitoring, and self-care management. These concepts are required of individuals attempting to be healthy and are especially important for maintaining or improving one's health in those with chronic diagnoses, such as type 2 diabetes. So, moving on, there was two studies that I identified that fit my adult population and fit the time frame of 6 months for study results. Study 1 was conducted by Syracuse, Kizilski, and Erger in 2017. It was a double-blind, randomized, controlled intervention study, and the setting was University Hospital in Izmir, Turkey. The sample size began with 139 patients. There were 70 in the intervention group and 69 in the control group. However, only 78 patients ended up completing the study fully. Some dropped out and some didn't participate in everything. So we only had 78 of the original 139 finish the study. The method used in this study was to administer a pretest and a basal HbA1c level check, and then to administer education based on self-care deficit theory to the intervention group only. And then everything was rechecked at 6 months. So if you go to the next slide, we have the results after 6 months. And as you can see in the table, there was a slight mean reduction in the A1C levels in the intervention group. However, there was also a mean reduction in the control group. And due to the similar reductions, the results were deemed insignificant in this particular study for A1C. There were some strengths in this study, and those were that it was a randomized and double-blind study. However, the limitations were very noteworthy. The patients were invited by phone, which increased the loss. The actual loss of the patients during the study was also a huge limitation to the results, and there were long-term effects of this intervention that have not been studied. So in conclusion of this study, the results were not significant for improving A1C, but as stated by the authors, these results were not generalizable to people in other diabetes centers as it was limited by the loss of study participants, and so these results were not very reliable for educational intervention. The next study was more promising. Study 2 was conducted by Sindhu and Jayakumar in 2017. It was a controlled trial without randomization located in a diabetic clinic in Kerala. The sample size was 140 patients. There were 70 in the control group, 70 in the intervention group. The intervention method consisted of one teaching session of 60 to 90 minutes. The patients got regular follow-ups and educational reinforcements each month by a registered nurse. And their A1C was checked at baseline, 3 months, and 6 months. So the result of the next slide The result on my next slide, as you can see, the results were very significant in favor for the intervention group. The mean A1C reduced by 1.13 in the intervention group and actually increased by 0.39 in the control group during the 6-month study. So this educational program was very successful in treating patients with diabetes and not only maintained but actually improved their condition in the intervention group. There were some limitations to this study. It was not randomized. However, in conclusion, the study had beneficial results and they would be achievable in a clinic setting. So next, I'm going to talk about the similarities between the two studies. So both studies had a diabetes education intervention, and the progress was tracked by A1C levels over a period of 6 months. The studies were also similar in sample size. However, Study 2 implemented more interventions within its educational program and included monthly follow-ups, reinforcement of the education, and in the end, it proved to be more successful as Study 2's results were more beneficial to the participants in the intervention group of that study. Study 1 also had a huge dropout rate, which could have interfered with the results of that study. While researching this topic, I found some gaps in the literature. Diabetes education in children, adolescents, and the elderly have not been well studied. These topics would be valuable for nurse practitioners in order to have a basis for how to treat different types of populations like these and what kind of education that they needed. My last slide explains how this review could be applied to a nurse practitioner's practice. As discussed, Study 2 made a more significant impact in improving glycemic control, and because not only was education given, but it was reinforced and the patients were followed up with on a regular basis, this intervention proved to be successful. So my proposal would be to implement this intervention in a clinic or outpatient type setting where the patients are seen regularly and contact information could be obtained. Educational sessions could be taught by a nurse practitioner, like once a month or so, and then it could, the education information could be reinforced by registered nurses who would make follow-up phone calls and check on the patients. I believe that this could work in that type of setting, and it would be very beneficial to patients with type 2 diabetes. So this concludes my presentation on the effectiveness of diabetes education. I appreciate your attention, and please email me with any questions that you might have on my topic. Thank you.